Hello friends, so this is Dr. Mihir again. I am a plastic surgeon, a hair transplant surgeon in the Venkat Center. So I want to talk about frequently asked questions before a hair transplant. Number 1, do I need a hair transplant? Well, if you are suffering from hair loss that is not reversible, then all that you need is a bit of medications and diet modifications and lifestyle modifications. But if your hair loss is genetic, if your father, grandfather, or uncles had hair loss, then you have an issue where you not just need lifestyle modifications, but you need more than that. That would mean medications as well as a hair transplant. Will I get the same density on the top of my head just like how it was before I balded? Well, the donor area that we have on the back of the scalp is a limited area. Hence, we're always going to find it difficult to get the density that you previously had. But what we aim to do is what is known as cosmetic density, which means that we pack the certain critical areas on your scalp that makes you less balded. So what is FUT and what is FUE? To put it in simple terms, FUT is what is known as the strip technique and the FUE is what is known as the dot technique. So FUT is where we take a strip of skin from the back of your scalp and take all the hairs within that strip, arrange it and then implant it where we made the holes. Whereas FUE is a process where we harvest one graft after the other at a certain distance so that the back of your scalp or the donor area doesn't look empty. The other few differences are the FUT allows you to harvest a lot of grafts and all of that can come from the back of your scalp. And the density above and below the scar will still remain the same. Whereas in the FUE, we're going to use a large area or the entire area, and at the end of the procedure, the density of the back of your scalp or the donor area will be reduced. FUT scar is a little more painful, whereas FUE scars are a little more comfortable. An FUT gives you the opportunity to use your scalp donor hairs even in the future, whereas in the FUE we might have to rely on other donor areas like the beard or your chest. Is hair transplant going to be very painful for me? Well, the initial few pricks where we give you local anesthesia might just hurt a little bit. It's something similar to an ant biting you. So after the initial few minutes of local anesthesia, you're going to feel very comfortable. It is very similar to how you feel when you have had a tooth extraction, where your entire jaw feels numb. Similarly, your head feels numb and you will be completely comfortable. You'll be completely at ease. Do I need to take medications and PRP even after the hair transplant? Definitely yes. The medications that you're going to take is very much needed to restore or to preserve your existing hairs. And consider PRP like a fertilizer for small saplings or plants which help them to grow faster. When can I see the full results of my hair transplant? Well, transplanted hairs grow a little slower initially compared to your existing hairs. So for the initial 2 to 3 months, you will pretty much look the same as you were before your hair transplant. At the end of about 5 to 6 months, you will see a noticeable result. Full results take anywhere between 10 to 12 months of time. So when can I resume my work after a hair transplant? Well, if you have a job where you're just going to work on a laptop, you'll be fine in a couple of days after your hair transplant. If your work involves a lot more of physical activity, then probably give yourself a rest of about 2 to 3 days and you can resume your work from 4 to 5 days after your hair transplant. When can I exercise after my hair transplant? So after your hair transplant, in the first 2 to 3 days, you're going to feel a lot better. And you can start walking, you can do brisk walking in the first week. You can start cardio exercises in the second week. You can go to the gym and lift weights at the end of 3 weeks. Can I wear a cap so that I can cover my scalp? Yes, you can. It's just important that you wear a cap that is loosely fitting, and you just need to take care when you wear it and remove your cap. You can also wear a helmet, but the same rules apply. You got to be careful when you wear your helmet and when you remove it. So friends, I hope you liked this video. So if you do like it, please press on the like button and subscribe to us. Thank you.